So imagine you've been referred for specialist hospital treatment. Now imagine you have no car and there's no direct public transport for you to get there. That's the situation many people in Eastbourne and Hastings have found themselves in over the past 10 years, as services have been spread between sites with the aim of improving care. Well, I've been speaking to one pensioner from Eastbourne who had to travel nearly 20 miles for her appointments. When the skin around Helen Pinnager's eyes became severely inflamed, it meant hospital treatment. But the specialists she needed are based nearly 20 miles away in Hastings. No car meant getting to her appointments has been stressful.
You can feel very alone with all this. So as well as whatever health thing you're going for, you've got this added sort of worry and, will I get there on time? And sometimes it's, it can be very traumatising. It can take it out of you physically or mentally or emotionally.
Helen's option via public transport is a 2-bus journey with a walk and a wait. Altogether, it's a 4-hour round trip, but even that's not always possible. More than once, she's ended up in unfamiliar surroundings trying to find her way home in the dark. One week, she spent more than £100 on taxis.
It's a problem if you get an early appointment because you've got commuter traffic and everything. But on the other hand, if it's a late appointment, then, especially if it's winter months, you know what I mean? And ending up in places where you're just not familiar, So all I wanted to do was just get home.
Patients used to be able to access all services at both Eastbourne and Hastings hospitals. But 10 years ago, the NHS decided to split those services, saying it made it easier to offer specialist care. At the moment, healthcare services are spread between the DGH here in Eastbourne, the Conquest in Hastings and Bexhill Hospital. So someone who may need a specific kind of treatment from one of those places has no option but to travel there. And currently, there's no kind of public transport that directly connects the sites. The idea of a shuttle bus to connect the hospitals was put to the Health Minister last week by the MP for Eastbourne, Caroline Ansell, who says 1 in 4 of her constituents don't own a car.
Of a recent survey conducted by my office of just 200 responses, so a small-scale sample, but nonetheless representative, 50 was the number of missed appointments cited by respondents. This is hugely expensive. And again, some of the commentary really difficult to read.
The Health Minister says he hopes to have a meeting with NHS England South East to discuss the idea further and see what options can fill the gap. For the staff, patients and their carers still facing long journeys on a regular basis, that can't happen soon enough. And Caroline Ansell joins us now. Caroline, just how typical is Helen's story? You highlighted some really heartbreaking cases in Parliament this week.
That's an excellent question. We don't know how typical. Of course, one is too many. And when I met Helen, I was really moved and troubled by her individual story. So it inspired a small survey on my part, and we had hundreds of responses. But to just how prevalent this is, well, we know anyone without a car is going to need to make this very disjointed, costly and time-consuming, potentially very stressful journey. So I am now working with the Hospital Trust, and we spoke yesterday, and we're going to really fix on these numbers and look at the services and where they're provided and just get a really proper fix on how many people are making this journey to better tailor then the response that we need to make, because we must see an improvement. This cannot be the experience people have when they're looking to access healthcare.
So you are calling for this shuttle bus between the hospitals. That's obviously really needed. But where does it go from here? What are you actually doing to make sure that that shuttle bus becomes a reality?
Well, a shuttle bus, of course, would be the ultimate campaign win here. There is, of course, quite a significant movement of staff between the two hospitals. We don't know the number of patients yet, but of course, every patient has visitors and carers also. So we really need to get a strong sense of that kind of cohort, that travelling cohort, to understand what would be most appropriate. It may be improving the services. The fact that there's no direct services already, that's an immediate starting place. It might be about integrated transport options, so sort of looking towards train journeys there. It might be looking at the eligibility around those who need the support to travel, whether that is sort of peer support, say in Helen's case, somebody to travel alongside, or whether it is around financial support, because it's very costly. Even the bus can prove to be very costly. And one of the issues at the moment around the support that is provided is it requires the patient to pay up front and then seek a reimbursement. So there's a number of different things that we are looking at. But of course, for me, the shuttle bus would be the ultimate answer to this on every level, including, of course, the environmental and our very congested roads.
A lot of people, of course, would say, why not just have one fully equipped hospital in Eastbourne and another fully equipped hospital in Hastings, and then nobody needs to travel?
Of course, and there needs to be a really strong clinical argument for why services are reconfigured and moved to different hospital settings. Of course there does. But I think we need to very much keep in mind here that our hospital trust has powered its way these last years from requires intervention and improvement. It was in special measures, and now it's good and outstanding. I can't imagine how the experience of the pandemic would have been if we had moved in to that experience with anything less than that strong foundation that they built. And in part, they have built this new, stronger performance around making changes so that they can either fully staff or recruit more specialist staff because of the number of cases they're looking at. So there is, of course, always an argument around clinical decisions, but it must be underpinned by transport and access to that. And this question is now going to feature on the agenda of that health board. So we're going to really drill down on this, and I expect to see, and we need to see, improvement.
Would you be happy then to see cardiology services moved away from Eastbourne?
Well, that, of course, is the current consultation, and it closed Friday. So one of the things they have had to look at is transport again between the two hospitals. They're not moving all cardiology services, it's around the cath lab. But again, that question around access, it might be the right clinical decision, but can those in need of that help access that care? And that is very much where I'm coming from. It's 1 in 4 who don't have a car, but my commitment is that no one is to be left behind.
Caroline, thank you very much indeed for joining us.